Today, we will talk about platelet estimates. But first, what is platelets? Platelets, also known as thrombocytes, that are small fragments that are found in blood produced in bone marrow. So what is their function? Their main function is to prevent or to help the blood to stop bleeding and initiate blood clotting formation at the site of injury. Platelets are important because they prevent excessive blood loss, promote wound healing, and help maintain normal blood circulation. Without enough platelets, the risk of bleeding increases significantly.
Now we know what and how important platelets is, we will now talk about the platelet estimate. Platelet estimate is platelets that are evenly distributed in a monolayer area of a properly prepared blood smear. By counting the average number of platelets seen in several oil immersion field and applying a conversion factor, an approximate platelet count can be estimated to assess whether the platelet level is normal, decrease, or increase.
So now, we will demonstrate the procedure for platelet estimate count using a peripheral blood smear.
But wait, before every procedure, we must always wear our proper and complete protective equipment such as lab shoes, lab gown, head cap, mask, and most importantly, the gloves.
First, a blood sample is collected from the patient through venipuncture and is placed in an EDTA tube to prevent clotting. The blood sample contains all the blood cells, including the platelets that will be examined. Next, a thin peripheral blood smear is then prepared on a clean glass slide and is stained using a right stain to allow the blood cells and platelets to be seen clearly under the microscope. Dip the slide into each solution of right stain set for 10 times in a slow, steady dips. Then proceed to buffer. This is usually dipped or flooded depending on your lab instruction. Next, place the stained blood smear on the microscope stage and examine it. Apply immersion oil and switch the oil immersion objective. Count the platelets seen in at least 10 oil immersion fields and compute for the average number of platelets per field. The average platelet count is then multiplied by the appropriate estimation factor according to the laboratory protocol to obtain the estimated platelet count per microliter of blood. Finally, record and report the platelet estimate count. This concludes the procedure for the platelet estimation.
The sources of error in platelet estimation. Errors can occur due to platelet clumping, which may cause a falsely low platelet count. Poor blood smear preparation and improper staining can also make platelets difficult to identify. In addition, delayed smear preparation and adequate mixing of blood sample may affect platelet distribution and accuracy. Other sources of error include giant platelets and EDTA-induced platelet aggregation, all of which can lead to inaccurate platelet counts. In conclusion, proper sample collection, preparation, and examination are essential for accurate platelet estimation.
The clinical significance of the estimated platelet count is that it helps determine if a patient's platelet level is within the normal range. It can identify low platelet counts, which may increase the risk of bleeding, and high platelet counts, which may be linked to certain health conditions. It is also used to check the accuracy of automated platelet count results, help diagnose platelet-related disorders, monitor a patient's response to treatment, and detect platelet clumping that may affect the count. Overall, it provides important information about the patient's blood clotting ability and overall health.